Okay, today we're going to discuss all about the specimen collection and processing procedure. So this topic will be discussing the different procedure on how you're going to collect the specimen from the different anatomic site for your bacterial culture. So this also speaks about how you're going to properly preserve, how you're going to properly transport and process the specimen collected from your different anatomic site for your bacterial culture. So we have here the considerations when we are doing here your specimen collection. So the first one, collect the specimen in the acute phase of the infection. So when speak about collecting the specimen in the acute phase of the infection, okay, you collect the specimen on the time we're in. Pag sinabing acute, that's the early time or phase of the infection. So you try to collect that one in order for you to have an early diagnosis of the patient condition and therefore able then to treat and manage the condition. Kasi pag late na, di ba? So what's the use of diagnosing it pag hindi mo na siya ma-manage? The second one here, you need to collect here the correct anatomic site. So like, for example, the patient would have the sepsis. So pag sabing sepsis, mean to say there's infection in the blood. So dapat ang ating sample for that would be the blood, not the urine or other body fluids. Okay, then the third one, we have here package the specimen that will maintain, okay, the organism's viability. Okay, so we have here different transport media. So when you're collecting your specimen from the bedside, okay, so like for example, if the laboratory is far from the area or ward or room where you try to collect the specimen, you can transport that one with different transport media that would eventually try to maintain the viability of your organisms. The next one, label the specimen accurately. So still applies the proper way of labeling your sample. It contains all the information. And number 5, transport the specimen to the laboratory promptly. So most likely, we try to deliver the specimen within 2 hours of collection. Or you can put preservatives so you could be able to preserve your specimen integrity. If hindi mo siya ma-transport at that as a very fast time or within the 2 hours of the collection process. Okay, we have here when we are collecting the specimen received in the microbiology laboratory could be in the form of the swab, aspirate, or you could also have here your, okay, the fluid or the body fluids, or you could also have here the tissues. Okay, the swab is not the best sample collection procedure or the method of collection because the swab would have here the following disadvantages. Number 1, since sinaswab mo lang siya, so konti lang ang ma-collect natin ng specimen. The second one, we have here prone to your contamination. So when you're collecting the specimen, you need to make sure that when you're collecting the specimen, it would recover here the pathogenic organism that try to cause here the infection. Hindi yung makokollect mo yung mga normal microbial flora in that particular site of your body. Okay, as what we have discussed sa previous na discussion natin, we have, di ba, we have different normal microbial flora. In the normal microbial flora, they are just present in that different part of your body. But they are not the one causing the infection. Di ba? So, we are after of the one really causing the infection or the pathogenic organisms. However, here for the swab, so may tendency ka na hindi mo siya or it might be contaminated by your normal microbial flora. Pag normal microbial flora, it's a contaminated na specimen. Because of course, we cannot release, okay, result for your culture and sensitivity that what you have identified as your organisms are the one na mga normal microbial flora because you will not be treating those normal microbial flora kasi ando naman talaga sila. But what we are after of would be your, okay, really the pathogen that try to cause the infection on that particular site of your body. Another one is the drying out here. So it is prone to drying out. When your swab dries out already, so it become harsh to your microorganism, it might die because of the drying out. Pag namatay yung organisms natin, meaning to say, magiging negative ang result natin. If we could not recover, we could not grow that by culture. So, ano yun? Paano iti-treat ng physician pag namatay sila, di ba? So, wala siyang organisms. Ay, anong antibiotic ang bibigay ko dito? Eh, wala namang organism na tumubo, something like that. It's because of your wrong na collection procedure or wrong transport mechanisms. The best way is your aspiration. Pag inaspirate natin ang specimen, like aspirate nito, sige, aspirate. You are collecting directly, okay, to the area where there's the microorganisms or the pathogen. Okay, your swab, however, are still applicable sa mga, okay, so saan ginagamit ang swab? So, nasopharyngeal swab. Nasopharyngeal is your sa ilong, di ba, sa COVID. Or you could have your oropharyngeal, OPS, oropharyngeal swab, or throat swab. We also perform here the swab when we're collecting specimen in your ears, in your eyes, or even in the genitals of the patient. But most likely, it's because na hindi mo siya ma-aspirate ang specimen directly, so swab na lang. But you need to consider several factors when you are using the swab for that. Okay, speaking about your swab, so if this one your swab, okay, the tip of that, ito, okay, the tip of that could be a cotton tip na swab, but also made up of your, okay, dacron. We have also here your calcium alginate. Okay, for the cotton tip na swab, most likely hindi siya ginagamit. Okay, because that one would have here contains a high fatty acid or lipids. Remember that your fatty acid or lipids would have here the antimicrobial property. It will kill your organisms. Another one is the shaft. Okay, yung hawakan niya could be made of the plastic. If we have a wooden applicator stick, parang ganon. You could also have here the metal. So, you should be very careful here with what you are using. Most likely, gumagamit tayo ng plastic. Okay, more than the wood here or the metal, because the wooden metals also would have your toxic activity with your microorganisms. Okay, we have here the different collection procedures. Okay, we start here with your blood collection. So when you're collecting your blood, you're collecting it in the vein of the patient. Okay, so when you're collecting that one, okay, so we put your blood here in a container. The container for the blood culture, yes, would be your dalawa. Pwede siyang aerobic. Other one is your anaerobic. Aerobic would allow the growth of your aerobic na mga organisms. Pag sinabing aerobic ulit, so those are the organisms wherein they grow, okay, even the presence of the oxygen. Pag anaerobic kasi, okay, those are the organisms wherein they will die in the presence of your oxygen. That's why they have a separate na culture media for their growth enhancement, or that would allow the support of the growth of those organisms. Another one you could also perform here, could you put also your blood in your, okay, anticoagulated blood with the SPS, so sodium polyanethyl sulfate. Ano ba? Sodium polyanethyl sulfate. Okay, so that one would have here the anticoagulant in your blood culture. Okay, when are you going to collect the specimen? So the best time to collect the specimen is during the fever or the spike of the fever, because again, pag nagkaroon ng fever, so the organism are found in highest concentration. You have much of the microbial load or microbial burden during the fever na state. So therefore, higher chance of recovering your microorganism on that. Okay, procedure, since we'll be collecting the specimen through your venipuncture, then you need to clean, okay, the site we're going to collect. So you need to disinfect the skin. Okay, you could apply the alcohol. You could also apply here your povidone iodine, or you could also have your chlorhexidine. Again, why are you doing here the disinfection? Because of course, you wanted to disinfect here the skin in order for you to allow the normal microbial flora in the skin to die, and therefore you're not able to contaminate your collection of your specimen. Kasi pag hindi natin na-disinfect, itong mga pag tumusok tayo sa skin, Itong mga microorganisms sa skin, papasok siya, magiging part siya ng sample mo ng blood mo. And of course, that will become a contaminant for your blood culture. Because again, we are not after of the normal microbial flora. We are after of the one really causing in what's present in the blood of the patient. Okay, we have this one. So, the quantity, so maximum of 3 na specimen. Medyo, ano lang siya, traumatic. I mean, invasive because we'll be not collecting only 1, but 3. Maximum of 3, but you can have 2. Okay, pag sinabing 3 or 2 na specimen, they are of at different anatomic site. Like for example, kung dalawa, so one in the left hand, the other one on the right. So, basta magkaiba. Okay, na anatomic site, you just need to indicate in your label kung saan mo siya kinolect na anatomic site. Okay, that one would have 1 hour interval. Okay, for the adult, most likely ang lagayan is 20 ml. And we have the children here, we have here the 5 to 10 ml per set. Okay, the next one, we have here your body fluids. Your body fluids includes your mga plural. Okay, mga plural or mga serous fluids natin like your pericardial, peritoneal, pleural. But you can also have your synovial or joint fluid, and we have also here your bile. So they are being collected by your needle aspiration technique. So when you're doing the needle aspiration technique, so you need to clean the skin then. Okay, that would prevent the contamination of your normal microbial flora in your skin. Okay, so we're going to put here your specimen. So you put that one in a sterile, na screw cap, leak-proof na container. And you could also have here a separate na anaerobic culture tube for the recovery of your anaerobic bacteria. How much? So approximately should be more than 1 ml. Pag less than 1 ml, reject. Kulang. Quantity not sufficient. Okay, then we have here the foreign devices like your catheter, Foley catheter, Foley cat. Okay, so before you try to collect these devices, to try to disinfect also here the skin. Okay, before you try to remove that one as your sample for that. Okay, then containers, still you put that one in your screw cap container. You could also have here your anaerobic culture tubes. Okay, then we have here the collection, the specimen for your CSF or the cerebrospinal fluid. So it's another needle aspiration technique in the form of your lumbar puncture where you try to puncture the vertebral column at the back. Okay, so it's being performed by the physician. So before you try to perform here, so make sure that the skin is also being disinfected. Okay, for the lumbar puncture, so for the specimen being also collected in your sterile screw cap container, or you could also have your anaerobic culture for that. Okay, so for the volume, we have here for the ordinary bacteria which try to cause here pneumonia. You could have or try to cause here some meningitis. Okay, so you could have here more than 1 ml. Okay, and in the case also of your viral, in the case of your recovery of your Mycobacterium tuberculosis or even in the fungal infection should be more than 2 ml. Okay, we have here the ears. So the ear here would have, when you're collecting a specimen for the inner ear, so it should be should use here a flexible na swab. We'll try to insert that one to the inner portion. But before you can do that one, you first clean the ear canal here by the mild soap. And if the eardrum is an intact, so try to perform here your aspiration. Okay, but if that one is broken, the eardrum, then you just need to swab. Swabbing is just rotating lang. Rotate mo lang for like 5 seconds. Okay, the outer ear that has being collected here by cleaning first. Okay, with the use of your moistened na swab with a saline. And try to swab the outer canal. Okay, by rotation. Okay, we have here the method of collection for your eyes in the case of the conjunctiva. Just in the case, for example, of your sore eyes, okay, pink eye, Okay, so when you're collecting the specimen, the conjunctiva of your eye, so try to use your two separate na swab for each of your eye. Hindi pwede na kung ano ginamit mo dito sa swab, ito din yung swab mo sa kaliwa. Like, pag may sore eyes, di ba, nilipat mo lang sore eyes sa kabila, di ba? So, you should have the separate na swab for that. Okay, so you swab here, try to moisten that one with your saline, and try to swab for, okay, for the two separate eyes with two separate na swab. Then, also try to put your specimen with your anaerobic culture tube, or you could also have here your, okay, you could also have your star screw cup container for that. Okay, then for the cornea, on the other hand, so medyo invasive ito, then that's why you need to, okay, give local anesthesia to the patient to lessen the pain. Okay, and then try to collect the corneal scrapings. This is a scrapings. Okay, try to collect the scrapings here by scraping it with your spatula. Okay, then we have here the gastrointestinal tract specimen for the case of your Helicobacter pylori. Helicobacter pylori is a causative agent of your peptic ulcer. So it's being collected by your gastric biopsy. Again, this was being performed by the physician. Another test, so we have here the biochemical test na urease. So this will give a positive result with your Helicobacter pylori. Okay, you could also perform here your for the gastrointestinal tract specimen for the diagnosis of your gastroenteritis or diarrhea. So you can have the rectal swab. Okay, so rectal swab, insert mo lang doon sa anus ng patient swab and try to rotate. Okay, and that's for the diagnosis here of your bacterial infection related to your Escherichia coli, your Yersinia enterocolitica, and we have also your Vibrio infection. Could also collect the fecal sample, but when you're collecting that one, you collect it directly with your sterile screw cup container. And try to plate, you have to try to transport the fecal sample here in the laboratory, you try to plate that one with the selective na media. So mga transport media na natin could hold your viability of the organisms, but upon receipt to the laboratory, you need to still plate or inoculate that one with their corresponding or respective na mga selective media for their growth. Okay, specimen here for the genitalia for diagnosis of your sexually transmitted infection. So for the female, okay, we have here for the aerobic na bacteria. Pag aerobic, most likely andun sila sa outer area lang. So for the vaginal cervix, that's being collected here by swab. Okay, so first, you need to remove here the mucus. Do not put lubricants or speculum on that because, of course, that would be, it try to interfere with the recovery of your organisms. Okay, try the swab. Okay, use here the flexible na swab. Try to swab here the endocervix. Okay, we have here the transport media. So again, it's just a temporary holding media that would maintain the viability of your organisms. So we have your AMIs, we have also your stewards. Commercial system, the transport media, we have your GEMBEC or the James E. Martin Biological Environmental Culture System. Again, pag nakadating ka na sa laboratory, you still need from this transport media, kukuha ka pa din at inoculate mo pa din sa kanilang respective na mga selective culture media. Okay, for the anaerobic here of your bacteria, so collect the specimen, the endometrium by your aspiration through the Bartholin cyst or cul-de-sac. So you should have here the separate na anaerobic culture tube for that. Okay, for the meal, so pero pag dito, pag may discharge, may nana na lumalabas, then that's the best sample for you to collect. Hindi ka na mag-swab. Okay, yun na lang. Ang discharge na lang kunin mo. Hindi ka na mag-swab dun sa loob. Okay, for the meal here, for the sexually transmitted disease like in the prostate infection, okay, for the prostatitis, you can collect it one by prostate massage and try to collect here the secretion. Okay, for the urethra here is the daanan ng ihi. So, you can swab that one by inserting here the flexible swab. Insert 2 to 4 centimeters sa loob and then try to swab. Okay, mga 4 to 3 seconds. Rotate mo lang. Huwag mo masyadong ipasok dun sa loob. Sakit, no? Okay, we have here the selective media here for the recovery of your recognized Neisseria gonorrhea. Most likely, we are diagnosing here for sexually transmitted disease when we're collecting for the specimen in the genitals with the Neisseria gonorrhea, for the Neisseria infection. So we have these are actually the selective na mga culture media for your Neisseria gonorrhea. We have here your Martin Lewis. You could also have here your Thayer Martin. Okay, then we have here the collection of specimen. Okay, with your lesion, with your wound, or we have your abscess. Okay, so when collecting the specimen, first you need to disinfect here the skin. Okay, with your swab pre-moistened with your sterile saline. Okay, so if the wound here is superficial, then you just need to swab the outer edge of your wound. But if you have deep wound, then you try to aspirate. Okay, so pag deep wound, we are most likely for us then, pag deep kasi through your aspiration, able to recover here and less contamination siya. Unlike if you are performing a swab, diba? So, it might be contaminated with your mga normal skin, in a normal microbial flora, just like, for example, your staph epidermidis. So, therefore, this aspirate would much be better for that if you have a deep wound that would allow you to really recover your bacteria. Then we have here the specimen for the respiratory tract. So, for the lower respiratory tract, we have here the sputum. The sputum here is basically the specimen of choice for the diagnosis of your pneumonia or even for your tuberculosis. But the sputum is most likely contaminated na specimen. Why contaminated? Kasi diba dito sa pag-akyat na pagdaan niya sa throat natin, it might be contaminated. It might be added by the microorganisms found in that area. Okay, so therefore it might be a contaminated one. And the sputum exam or sputum collection procedure here is very difficult, okay, to collect. Okay, so you can collect the sputum here through your expectorated or deep cuff. Okay, you can perform here your sputum exam or collection by your deep expectorated cuff. Okay, so procedure for that, so it's being collected early in the morning. So as soon as patient arises from sleep, so the patient will just be instructed to gargle with the water. So the patient should not have taken a meal. Okay, so approximately for the diagnosis of your Mycobacterium tuberculosis, approximately there are 3 na specimen collected every day for 3 consecutive days. But I think ngayon sa ang interim guideline ng Department of Health is already enough ang 2 specimen for the diagnosis of your Mycobacterium tuberculosis. Pag 3 collection, 3 consecutive days, early in the morning, should be 2 out of 3. Pag sabing 2 out of 3, 2 sample here should be positive for the presence of your Mycobacterium tuberculosis for you to consider someone as positive. Pag 2 collection, 1 out of 2 is already enough here for to diagnose someone to have here the Mycobacterium tuberculosis. Why are you doing that one? Why are you not collecting once lang? It's because here of the irregular pass out of your microorganisms. So baka ngayon nag-collection ng sputum tapos baka walang organism pero meron siyang Mycobacterium tuberculosis or the patient's already been infected. Only that, that time na nagko-collect siya, hindi napasama ang ating bacteria. So why you are collecting the specimen for like 2 times, 3 times in order for you to really certain here kung positive talaga siya or hindi. When you're collecting the sputum here, you collect the sputum, hindi ang saliva. You would know here if there is specimen saliva. If not, if you perform here your microscopic identification like in the gram stain, kahit magsinungaling ang patient, makikita pa din sa result niya sa ating gram stain. Kung saliva ito, madami kang squamous epithelial cells, konti ang ating WBC. Okay, then we have here another way for those who could not able to collect here the specimen by your expectorated. So you could also have your induce. Induce collection here is by giving the patient with your aerosolized droplets that try to induce here cough reflex that would allow the patient to collect the specimen. But then again, kung Ang specimen ni patient is induced, then you need to indicate that one in the result form for the proper interpretation of the result. Another way of collecting the lower respiratory tract specimen here would be the BAL or the bronchoalveolar lavage or the bronchoalveolar washings. This was being collected through your sheatheded catheter connected doon, paloob. Okay, so that's for the collection of your upper respiratory tract or lower respiratory tract specimen. Okay, then we have here the collection of specimen in your upper respiratory tract. So upper respiratory tract includes your nose, your throat, saka nasopharynx. So first we have here your external nares or simply your nose. It's being collected here by your pre-moistened swab. Insert mo lang doon and then try to swab. Okay, then we have also here your nasopharyngeal swab or you call it your NPS. So you need to use here flexible na swab. Insert mo dito tapos papunta doon. Almost one half ng ating swab dapat ay naka-insert. That would allow you to reach here the back of the nasopharynx. Itong ginagawa sa COVID natin. Papunta doon sa taas. Okay, so make sure na you're able to reach here the back of the nasopharynx for you to collect the specimen. Kasi pag hindi, pag dito ka lang sa outer, it might have here the negative results. Okay, so from the nose, doing the posterior back of the nasopharynx and try to rotate. Okay, so this would help you to diagnose here the causative agent of your whooping cough caused here by the Bordetella pertussis. Next, we have here the oropharynx or the oropharyngeal swab or your throat swab. So, it's being done by depressing the tongue of the patient. So, i-depress natin ang tongue niya, ganon. With your tongue depressor and try to collect. Okay, doon. Okay, try to collect here the tonsils or try to swab the tonsils or the back of the throat, doon sa likod. Or you could also have collect here the inflamed area. Pag nakita ka na inflamed, di ba? Inflamed is nagre-red naman siya, di ba? Na namamaga ang kanyang lalamunan. So, that's what you're going to collect. But in the, for the COVID, we are not touching the tonsils. Doon tayo dapat sa back of the throat mag-swab. Okay, that one is, I never ever touch here the tongue of the patient because, of course, it might be contaminated with the bacteria on that area. Okay, this one is used here for the diagnosis of your strep infection caused here by your strep pyogenes. You have also here epiglottitis caused here by your Haemophilus influenzae, and we have your oral gonorrhea caused here by Neisseria gonorrhoeae. Another specimen here that we could eventually collect here or use here for our culture and sensitivity, we have here the urine for the urine culture and sensitivity. The following method of collection for the urine. So the first one, we have here the midstream clean catch. For the midstream clean catch, okay, just like as what we have discussed in the AUBF. So first, you need to clean the external genitalia. So for the male, okay, try to retract the glans penis. Okay, and then for the female, try to retract here the labia major, and then try to collect the specimen. So for the midstream clean catch, the first portion of the urine is being discarded and try to collect the middle portion. But ascertain that you're able to collect here in right volume. Baka naman akala mo ay nasa gitna pa lang, ay yun pala patapos na, so wala kang makukollect na urine. You could also collect specimen here from our catheter here for those patients who are not able to void the urine. So, lalagyan siya ng catheter. So, for this one, first, upon insertion here of catheter, you first try to disinfect the area with your saline. Okay, and then when you're collecting the urine here from the catheter, so the first 10 to 15 ml is being discarded. Because this one is contaminated na urine, then you try to collect the next portion or the remaining portion. We have also here the end-wearing catheter. So, disinfect here the collection port. Okay, so parang may ganun siya. Okay, doon ka kasi ko-collect ng urine natin by aspiration with your syringe. That's why you need to clean the port here. So prep-pubic aspiration technique here would allow you to have your anaerobic culture of the microorganism found in the bladder. But this one is invasive. Okay, so we'll try to insert here your needle in the abdomen part directed towards the bladder. So when you are inserting the needle to the abdomen part, first you need to disinfect, okay, with your alcohol or even your povidone iodine. Insert the needle up to the bladder to collect here your urine sample in the bladder. That would give you a representative sample in the bladder for your anaerobic culture. And pag aspiration kasi, it's more be like, it will be less, less contaminated by your external microorganisms found in the skin, like just like your midstream clean catch or random na mga urine sample.